name is Frank Cohn. I'm the Executive Director of VAST. VAST is the Vancouver Association for Survivors of Torture. We have been around and providing services to clients in need since 1986, 31 years ago, started by a group of activists who were responding to the needs of Central American refugees who were arriving here at the time. And since 1986, VAST has served successive waves of refugee clients seeking services, or those who are arriving in Canada and Vancouver, not necessarily knowing what counseling is, not necessarily knowing what therapy or group support is, but knowing that they are coming from a place of significant need, that they are survivors of experiences that nobody should have had to undergo. And our staff, many of whom have been with us for a long time, do an incredible job of providing support to these clients. We know from our experience with our clients, and we know from the research, that we should be providing 5 to 8 sessions at a minimum to each of our clients that are coming through, and that this is what it takes to really work through some of the most significant challenges in terms of mental health and trauma and torture treatment upon arrival. That said, because of challenges with funding, because VAST no longer receives federal funding, because our funding on a provincial, municipal, and private level is limited, we are only able to serve clients for a smaller number of sessions each. What this results in is that we're able to do some really profound work in those first few sessions, but we're often not able to bring that work to full fruition. And that means that a lot of clients are left without all of the support that they need, and they're moving into new housing, they're moving into, whether it's Surrey or Langley or Port Coquitlam, they're moving into work, they're moving into new family life, and they've got some of the tools and skills from our counseling team that help them to adjust, but the reality is that they do need more. And the reality is that we've got a steady stream of referrals from all of our partners around the city, from health clinics, from schools, from refugee serving organizations, and that our capacity to serve those clients is quite limited. We have a waiting list that always has a healthy number of clients on it, and we'd love to be able to get through that waiting list more quickly. We'd love to be able to serve our clients with more sessions. We'd love to be able to open our door when clients feel the need to come back, because as we know, mental health is not something that you get a prescription and you're out the door and you never come back again. A lot of the challenges can be recurring, and to be able to come back and meet with a counselor again can just provide a fundamental lifeline to clients in moments of stress and re-traumatization. So we know that we need additional funding to be able to do our work best, to be able to build the community that is supporting the clients that we're working with, and to be able to provide the extensive experience and knowledge that we have from practicing in this torture treatment and trauma treatment arena for 31 years to organizations around British Columbia to meet their needs in terms of refugees who are arriving on their doorstep with complex mental health challenges. One of the ways that VAST really makes sure that the limited funding that we have stretches incredibly far is through partnerships, through hard work of our staff team, of course, and through using a group and community-based approach. So partnerships, for example, we work with all different immigrant settlement agencies around Vancouver and British Columbia, and when they need a more complex mental health lens or trauma-informed lens, then they call on our staff, and we run groups together with them. We meet individual clients on site at their offices, and so we're able to make the funding stretch even further through this collaboration and partnership with other immigrant settlement agencies. We also really need to emphasize that the mental health support work that VAS does is preventative work. What this means is that we are seeing clients when they first arrive in the country, managing some of the deep trauma and stress that they are emerging from. And that if we're able to get these sessions individually and as a group, and if we're able to connect these people to a peer support network, then we know from our research, we know that these clients will be more successful in the long term. We know that the mental health and physical health challenges that they'll be presenting in the long term will be reduced. We know that they'll be better adjusted. We know that they'll ease more appropriately into employment, into housing, into family and community life here in Vancouver. And so we know that this minimal intervention at the outset of a refugee's arrival in Vancouver is an incredibly cost-effective approach to managing their long-term experience in country. We also know from the IRCT, the network that we're a part of, the International Rehabilitation Council for Victims of Torture, we know that research shows that 50% of refugees are torture survivors. We know that torture survivors have a very particular set of complex mental and physical health needs that require attention, acknowledgement, and support upon arrival. If those needs are going untreated, and again, we're talking about 50% of the refugees who are arriving here having survived these truly harrowing experiences, and if these go untreated upon arrival, we can't imagine that they disappear over time. They emerge later, and they emerge in ways that are more costly to the system later. And so again, dealing with them from the outset is one of the most cost-effective strategies to ensure successful integration and settlement.